If you follow this discussion, we realize something that when the medical residency program was introduced, the beautiful concept to train graduate doctors to specialize in different areas, and it became popular because they provided a cheaper workforce to the hospitals, you know, and we're able to cover multiple roles, and so hospitals that were understaffed will be better served if they have resident and doctors. Now, if you notice, the interest was in saving costs and in providing 24 hours care to patients. So you see that focus was on saving costs and providing care to patients. And in 1984, when the Libby's Zion's issue and death happened, the unfortunate death happened, the focus was also on patient safety, which is right. Patient safety is of top priority in medical practice. But if you notice, there's not a lot of attention on the health of the doctors. This long shifts, Ironman mentality of a doctor working for several hours, rite of passage, able to show that you have endurance, you have stamina, able to have that bragging rights. I'm able to stand for several hours, I'm able to conduct several surgeries and all of that. The consideration was not so much on what is the effect of these long hours of work on the health of the doctors. The doctors, the physicians that are spending hours and hours doing this, what is the effect on their health? There is a concept called burnt out syndrome. Burnt out. The concept was coined and conceptualized in the 1970s. The burnout syndrome is said to be a state of deep physical, mental, and emotional exhaustion caused by prolonged and excessive stress. State of deep physical, mental, and emotional exhaustion caused by prolonged and excessive stress. Concept was developed and popularized in the 1970s by American psychologist Herbert Freudenberger, and also by a social psychologist, Christina Maslach. And the Maslach did a number of research, and they came up with the Maslach burnout inventory, MBI. The three key components of the burnout syndrome is that you have exhaustion, feeling emotionally drained and depleted. You have cynicism or depersonalization, a negative or detached attitude towards one's job and the people that are being served by that job. Then you have inefficacy, a feeling of reduced professional accomplishment. So these were the key features of burnout. This concept was popularized in the 70s and the 80s. Then eventually in 2019, WHO formally recognized burnout, and it was included in the International Classification of Diseases 11, ICD-11, where it was described as burnout resulting from chronic workplace stress that has not been successfully managed. Symptoms of burnout include exhaustion, cynicism and detachment. Person becomes detached from his job, reduced performance. Then the person can experience physical symptoms like headache, gastrointestinal symptoms. Then mental health issues can also arise. There's increased risk of depression, anxiety, insomnia, and substance misuse or abuse by those who are experiencing burnout. And the causes of burnout, we've seen excessive workload and pressure, lack of control or autonomy over one's work, unfair treatment or toxic work environment, lack of reward or recognition for for effort, conflict of values between a person and their job, and insufficient social support from colleagues or leadership, you know. So that is the burnout. And this burnout is something that um, has become recognized as something that is prevalent among doctors. It's prevalent in sectors like health and education. You know, the burnout is different from general stress or depression, as it's specifically tied to occupational demands, although it can overlap with with these conditions, can overlap with stress or depression, but burnout specifically is linked to occupational demands. The prevalence is high among physicians, particularly among resident doctors. So one of the effects of these long hours of work is that doctors, physicians can experience the burnout syndrome, and it can make them have mental health conditions and situations. So what are some of these mental health conditions that could arise as a result of the work that physicians do? It's been shown that depression rates among physicians in the US, one study showed, is 28.8%. Depression rate among physicians was 28.8% compared to 18.4% in the general US population. So you have higher rates, close to double the rates in the general population. Higher rate of depression among physicians, high rate of anxiety. 44.6% of physicians experience anxiety. Then there's also substance abuse, including alcohol dependency and drug addiction. And this could be as a result of maladaptive coping mechanism. You know, the use of drugs by the physicians that are involved could be a way of them trying to cope, which is the wrong way of coping. That's why it's called a maladaptive coping mechanism. Then suicide. Suicide rates are more common among physicians compared to the general population. Suicide rates are 28.8 per 100,000, 28.8 per 100,000 physicians. It's more than double. General population is 12.3 per 100,000. So it's more than double. The suicide rate is more than double in physicians compared to the general public population. Female physicians have 130% higher risk of suicide, and male physicians have 40% higher risk. His study showed that only 29% of those who died by suicide have sought mental health care in the prior year, meaning that many of those who experience mental health challenges did not seek mental health care in the prior year. Only about 30% sought mental health care. Annually in the US, 300 to 400 physicians die by suicide in the US. Surgical specialties showing elevated rates. Surgical specialties, the different surgical specialties. And the surgical specialties are characterized with long hours, long work hours in the theater and in taking care of patients. Remember, so we've been talking about surgery, Dr. Oluwafemi, Dr. Edigba, Dr. Umo Michael. They were all in the surgical arena when they died, you know. And burnout is a significant contributor to untreated depression and other conditions, which could also lead to suicide. Then there are anecdotal reports of doctors who collapse, sudden collapse, and non-suicidal deaths, you know, and burnout induced stress and overwork could be a factor in this instance. You know, suicide is said to be the second leading cause of death among medical residents. Second leading cause of death among medical residents. And the most common cause of death among male medical residents, underscoring burnout fatal potential. Among male medical residents, suicide is the commonest cause of death. Then among all residents, male and female, suicide is the second leading cause of death. And what is the characteristic thing with medical residents? They spend long hours of work, leading to burnout. And from burnout, they develop medical conditions which often they minimize and are not properly treated, and which could now lead to suicide. Burnout is associated with a 22% higher all-cause mortality and 31% higher cardiovascular mortality due to chronic stress effects on the body, such as immune dysfunction and hypertension. Quality of life. Physicians work 50 to 70 hours weekly, which is 20 to 30 hours more than the average Americans. So physicians work 20 to 30 hours more than the average Americans. So, and that can lead to improper work-life balance. They have less time for other things other than work. They have desensitized empathy and reduced moral obligation. It can lead to reduced work satisfaction, cognitive dysfunction, and accelerated aging. So there is reduced quality of life as a result of more overwork, extended work hours. And the overall impact could include chronic diseases like diabetes and cancers. So here we've seen that yes, work hours has been an issue in the US for many decades. After medical residency was introduced, there was no regulation on the hours that medical residents work. Hospitals, departments were made to put out rosters and schedules, and oftentimes the medical residents were overworked. It was seen as a thing of pride. Iron Man mentality. The more you could endure shows how dedicated you are to the work, shows how well you be qualified to work as a specialist, as a consultant and physician. And we saw that was the case till 1984, when Libby Zion's case happened, and the father, Sidney Zion, was a lawyer and a writer and a journalist, was able to bring attention to the hours that were worked by residents, and that led to the Bell Commission and to Code 405 in New York, and also it was adopted in 2003 by the US body. You know. Now, in all this conversation we're having, you notice that there is no talk of what has been done in Nigeria. As to the residency program in Nigeria is patterned, like in other parts of the world, it's patterned to the Osler John Hopkins model in the US, and resident doctors also work long hours here. I was seeing the effects with the deaths that have been reported. But there's not much about what is being done in terms of regulation of the hours of resident doctors, the hours they work, and stuff like that. But I hope that with these incidents that have taken place, something could be done. Now, what can we do? You know, everybody has a role to play. Everyone. whether doctors or non-doctors, as a society, as government, as bodies. The doctor, a doctor, a physician, a resident doctor has himself or herself has a role to play. The departments the doctors work under has a role to have roles to play. The hospitals and institutions they work under have roles to play. Regulatory bodies like the Medical Dental Council of Nigeria, the West African College of Physicians, West African College of Surgeons, the National Postgraduate Medical College has a role to play. Professional associations and bodies like the National Association of Resident Doctors, the Nigerian Medical Association, their pressure groups which they have role to play. Ministry of Health, national governments, international bodies like the World Health Organization, they have roles to play. I'll start by talking about what a doctor, as a doctor, what should you do?